How is your blood glucose level affected by sex?
Most commonly, it's going to be a sensitivity to your insulin and a drop. But some people, I've talked to many people that experience a rise in their blood sugar just from the pleasure and excitement. So that's always fun. Solution to that, though, of course, is to work with your endocrinologist or your healthcare team. Make sure that you understand how temporary basals work if you're wearing an insulin pump, as well as if you are using MDI or long-acting insulin, you might just have to have a snack beforehand just to make sure, keep the juice box on the nightstand and share one with your partner. That always works too. But just knowing that it definitely could affect your blood sugar just from the physical exertion as well as some of the emotions that you might experience.
What if I don't want to wear my technology for a date? Or if it's just a hookup, is it bad to go on shots temporarily because it feels less complicated? How do I tell my doctor I want to go on MDI because sex?
This is actually a fairly common experience. I personally actually put on an Omnipod when I want to have fun. So that people change the way they're doing things. So again, if you have the access to that sort of thing, that's totally reasonable if you feel like it'll make your experience better. Not something that is weird to talk to your provider about. You honestly don't even really have to tell them it's for sex. You could just say, there are several times where maybe I go to the beach or something like that and I like to have my pump off. I would encourage you to talk to them about it being for sex just so that they can give you more explicit instructions. But it is not a uncommon thing to do, and it's generally something that an endocrinologist or a diabetes educator is very familiar with.
Are CGM sensors during sex weird?
No, I do not think CGM devices are weird. I don't think any medical device is actually weird. If anything, I'd be really thankful that my partner has it, because if something happens where they're having a crisis during our sexy time, I'm like, oh yeah, they're orgasming, and no, they're actually bottoming out. That would be really catastrophic. If I'm like, yes, we did something great. Oh no, you're unresponsive. This is not okay. And that's really important because pleasure is a birthright and you have rights to all your pleasure.
Where the hell can I put my pump during sex? Where are other people putting it?
There are a lot of people that wear their pumps, and if it feels right to do that, then that's okay. A lot of people keep them in their bras or hooked to underwear or just laying out there. Whatever is your preference. That location is totally up to you. And I've seen all kinds of different locations, and everybody's doing something a little different. But I can assure you that we are all wearing our pumps, and it's okay.
Is there a sexy way to say, I need sugar, I feel like I'm gonna pass out?
People need to take a break from sex for all kinds of reasons. They're thirsty, they have a cramp, they're tired, they lose their erection. Like, there's all kinds of reasons we may need to pause. So this is just another one of those things. I mean, I guess you could always say, God, the sex is so good, I just need to get some sugar in me. I need a break.
Can lubes with sugar in them make my blood sugar spike?
You'd have to probably ingest a lot of lubricant. It wouldn't necessarily cause a blood sugar rise for you personally. There might be a little bit of it if our sugar and carbohydrates are digested in your mouth, so it's very possible. But it's such a small amount, it's probably unlikely. The biggest thing you need to worry about is just making sure that you are cleaning the area if it's coming into contact with the genital area, especially if you have like a vulva and a urethra. We want to make sure just clean very thoroughly there, just to get rid of any extra sugar so that it doesn't promote an infection.
Diabetes, at least for me, has impacted my libido. How do I help myself get back to my higher typical libido?
Arousal, interest in sex, and achieving an orgasm can be just more difficult if the blood sugars are elevated in that moment or have been chronically elevated for many years.
Even just living with a chronic illness can affect whether you have a higher libido or not. You're definitely not alone in that. Whether you feel unworthy or you're just feeling like, gosh, I've been managing this all day. This is the last thing I want to do.
One of the best pieces of advice, and it sounds counterintuitive, is just to have sex or masturbate. Sex is like a muscle. The more you work it, the more you exercise it, the stronger it will be. This can include things like regular masturbation, setting a date for that, setting a date for sex, buying new bedroom clothes, buying new lingerie, buying things that would make you feel sexy, buying new sex toys, stuff that kind of, helps bring some variety into it or bring something new to sex that would make you excited for it. It can be really tough when you don't feel like having sex to do these things, but the more you try, usually the easier it is.